Happy Thursday, everybody. Welcome to Wake Up Charlotte to Go. I'm Ben Thompson, joined by Sarah French, as always. And we are lucky to be joined by Dr. Katie Passaretti. She's the Medical Director of Infection Prevention over at Atrium Health. Doc, thanks for coming on again. We appreciate it.
Thank you guys for having me.
Folks at home watching this either on your phone or computer, if you have any questions, let us know. We'll be talking with the doctor over the next few minutes. Doc, let's talk about this Omicron variant. It's what everybody's talking about. It's happened just a few weeks before the holiday season, before people are going to be home, inside. And a lot of people are worried that we are headed for sort of a perfect storm of bad elements. Is that overly concerned, or do you share that same concern?
Yeah, I do share some of those same concerns. There's some promising features of Omicron. There's some concerning features of Omicron. We're already, still being hit by Delta. So the fact that we are likely going to see Omicron in our area with an increase in cases on top of that, right at the same time that everyone's getting together for the holidays, traveling, it is really the perfect storm for kind of bumping up those numbers even more, and kind of highlights the importance of doing everything we can to protect ourselves and protect our families.
Yeah, so Tracy on here asking, does the United States have Omicron? And yes, it has been detected in the US, but we haven't detected it here in North Carolina, right?
Correct. So we haven't detected North Carolina or South Carolina. Probably the closest states, kind of Georgia, Florida, they have had, 1Z, 2Z kind of cases. We haven't seen substantial spread in the United States as of yet, but I think, it will continue to spread. It will be in our area before long, and we will, see those cases, pop up before too much longer.
And people should not be necessarily alarmed when that happens, because you guys are expecting it will happen, and it will happen probably soon.
Yeah, no, I think, we've unfortunately been through this drill several times now with different variants of COVID. And, in a way, we're a bit lucky with Omicron, how quickly it was identified, how quickly scientists have looked into the features of the virus. So we have a heads up here, whereas we really didn't for Delta. We were already in the thick of it before kind of Delta was identified and we knew. So, again, some promising time and heads up to be able to kind of do what we can to protect each other.
So Cheryl saying, is it in South Carolina? You just answered that it hasn't been detected yet. But then she asked, is it worse than COVID? And this is a variant of COVID. But I guess, how would you compare this to Delta and maybe some of the other variants that we've seen?
Yeah, so we're still learning, right? This variant was about 2 weeks ago, right? Right before Thanksgiving, we started hearing about this out of South Africa, and we're starting to get information in, but there's still a lot of unknowns. The things that we worry about with variants is how easily spread it is. The early data looks like potentially more easily spread from person to person than Delta, so that's not a great one. The other things we worry about are whether it has immune escape, so impact of vaccines, impact of treatments. That one takes a little bit more time to figure out. We're starting to see some information this week that, the vaccines may have slightly decreased protection compared to Delta and other ones. But good news is that, data out of Pfizer yesterday at least suggested that boosters kind of bump that back up and give you that protection. So kind of highlights the importance of people. If you're vaccinated, awesome. If it's appropriate, go ahead and get that booster. And then the third thing that we worry about is severity of illness. So that's, and what populations are impacted. So, does it act differently in children? What's the kind of rates of hospitalizations? And we're still very much learning on that one.
You just mentioned kids. Tracy followed up on Facebook asking, she works with kids, any other concerns that she has or needs cautions that she needs to take, given the dynamic that is now Omicron?
Yeah, the good and bad of COVID, all these variants, the same protective measures protect you, right? It's get vaccinated, wear your mask when you're in indoor kind of crowded settings, don't go to work sick, make sure those around you aren't going to work or school sick. It's those same things we've been kind of talking about for the past couple of years that continue to be very important and are what is the best way to protect yourself and those around you.
So let me ask you this. A lot of people getting ready for the holidays to be with family. My family's doing the same thing. We're vaccinated. However, I have a 3-year-old who doesn't have the opportunity to be vaccinated. What should families be doing? What concerns should we have, especially if they're around, grandparents?
Yeah, so, vaccines are protective against severe illness and death. So those that can be vaccinated, getting vaccinated, we're 2 years into this. People need to be with their families. They need to be able to see grandparents. Just, make sure when you're traveling, your kids aren't sick. If so, you need to keep them away from those grandparents who are susceptible. Make sure everyone, if possible, if families are willing to do that, everyone's vaccinated and boosted. Those are the steps that can kind of protect you and your family.
Kelly Eichert, I think, is bringing up a great question. Points out that severity so far seems less, which I think we're starting to figure that out. But I think the interesting thing is a phrase we haven't heard in a while. That's herd immunity. Where do we stand now when it comes to herd immunity? Because that was sort of the goal all along, and I feel like we don't talk about, including us in the news, we don't talk about it that much anymore. Is that still a thing?
Well, so I think more shifting the conversation from herd immunity to the virus being one of our usual cold viruses, flu viruses that so that endemic state, rather than everyone's protected like with measles or smallpox. So, getting to the point where enough people are protected through vaccines, through prior infection, that we may see, little bumps in cases, but it's not this tremendous number of cases that, have the potential to overwhelm healthcare. So kind of shift the conversation to that kind of expectation. We're not going to get rid of COVID, clearly, right? So it's more, how do we control it? How do we protect as many people as possible?
So that was my question. If it's never going to go away, then what do you see in the future? Is this something like the flu vaccine where we're going to have to get one every year or every 6 months?
Yeah, that's the $1 million question, right? We've seen that we have seen that vaccines kind of, and with many vaccines, that protection can go down over time, and those boosters are needed. And we've seen many variants kind of come our way. So, I think decently likely that it will become like flu, where you need some sort of more regular vaccine, whether that's annual, every 5 years, that's still to be determined. But, that's not unexpected for respiratory viruses, honestly.
Doctor, what do you think? I realize this is also a public policy issue that people in public health and government also have to answer, but what do you say to the folks who say, like, okay, when are we just going to get back to normal? And if that means a vaccine every year or a booster every year or something like that. But regardless of the variant, regardless of new developments, that we're just going to have to get back to normal because everybody that wanted to be vaccinated has been vaccinated. Everybody who wants to wear a mask can wear masks. Knowing that there's no easy answer here, when do you see that, if ever, happening?
Well, we're easing, I would say, back to normal. I think maybe thinking about a new normal. There may be some protective mechanisms that we need to continue into the future, whether that's during respiratory viral season when this virus is really going gangbusters. We kind of go back to masking in certain areas, whether that's additional doses of vaccines. I know it feels like we're in this infinity loop of doing the same thing over and over. But, this year is very different. People are, able to be with their holidays, and that's largely due to vaccines and where we've come so far. So I do think we're ever getting closer. I know it's much longer than any of us had hoped. And the important thing is keeping people alive, right? So preventing severe illness and death, and keeping our healthcare systems running where we're not overloaded with patients and can't take care of that. So that's kind of the metrics that we're continuing to look at, strive for, and make sure we're protecting our communities.
Let me ask you real quick. There's been a lot of talk about all the different tests, like PCR tests, rapid tests, at-home test kits. I know early on, a child in my child's daycare class had a false positive from an at-home test. So what tests should we be doing? I know everyone's having to turn in negative tests to go places and do this and that. So what do you suggest?
Yeah, so, good news is that, at least from what we know so far, all the tests do likely pick up Omicron, so should detect it. All of the tests have their place, honestly. Antigen tests are very quick and easy and are good at picking up when you have a good amount of virus in your body. So if you're symptomatic is really when they're the most useful. That, like you had with a false positive and false negatives increase if you're doing testing when someone doesn't have symptoms. So best used when you have symptoms. PCR test, which is that one you send out that takes a day or so to come back, is more sensitive. So we'll pick up lower amounts of virus. So that's kind of the cross-check test. That's the one we can do sequencing on and figure out what's going on in our communities as far as variants. So I think there's a time and place for both. You just have to know the pros and cons of the different tests.
All right, Dr. Katie Passaretti. Doctor, thanks for taking time. We know you are a very busy person, and I know our viewers and followers on social media appreciate having someone of your expertise sort of right here, being able to answer their questions right here on social media. So I know they appreciate it as well, and I know the community appreciates your expertise. Thanks for coming on with us.
Thank you so much.
All right, take care.
Bye.